You're watching the Wellness Hour Live. I'm Randy Alvarez. Today's topic, pain management and a procedure that stimulates the spine and blocks, I guess, the signal for pain. And without medication, many people across the country are pain-free. With us, we have an expert on the topic, pain management physician, board certified, Dr. Roland Reinhart. Dr. Reinhart, welcome to the program.
Thank you for having me.
So is that true what I just said, by the way?
That
there
is.
are a lot of people
It is.
without medication?
It was a little muddled, but yes, Randy, it
Thank you
is.
very much.
It is. Yes. So the idea here, and actually this is kind of, the technology is not necessarily new, although it's been improved on, is to block the pain signals that are coming from the periphery from getting to the brain. You know,
Well, that's what I said, by the way, and you called it muddled.
Yeah.
That's exactly what I said. We'll have to play back
That
the
is
tape.
exactly
okay, go
right.
ahead, because it blocked the signal, right?
It's exactly right.
Okay, so go ahead.
So the concept really is that you don't have pain, let's say, in your back or down your leg. It's really the interpretation by the brain of the signal that gets to the brain. So if we can change that signal, and you know, typically that's what drugs do. They bind receptors and change the signal. But this is using stimulation at the spinal cord, and that's not the same as stimulation at the nerve. So when people have a TENS unit, they're stimulated. They put electrodes on their skin and they're stimulating. This is actually stimulation of the spinal cord. And at the spinal cord,
So electrical stimulation? So something has to be implanted in the body?
Correct.
Okay.
So we put two little wires. It's like doing an epidural steroid injection. People have had back pain. But instead of injecting a fluid, we slide two little wires up into the spine. And then the way the spinal cord works, the nerves from the periphery don't go all the way to the brain. Actually, they're rewired when they get to the cord. And the sensory information, the majority of sensory information sits on the back of the cord. So if you put a couple wires in the back of the epidural space and you electronically stimulate, you'll stimulate selectively just sensory tracts. And so you change the stimulation going to the brain. And the brain then interprets that signal as it's warm and tingly and so on.
Well, so it's more of a warm, tingly.
It's a warm, tingly. You're not eliminating all signal, right? If you fall down and break your leg, you want to know you broke your leg. But on the other hand, basically the brain can be told, hey,
So like
something
it
else
interrupts
is
this
going.
pattern.
It does.
This communication.
Exactly. So we're just overriding the signal because we're going to an area in the spinal cord above the area of injury.
Does that though hurt? Do they say, oh, that feels like a little burning sensation?
It's typically not. And actually the beauty of this procedure is you get to try it first. So unlike spine surgery, you put up a couple test wires, you try the stimulation for 3, 4, 5 days, see if it actually improves your pain the way that you want it to improve your pain. If that feels better, then great, you go ahead and implant. If you don't, you take the wires out, there's no surgery, nothing's ever, you've never been cut open or had anything done. If you go to implant, then there's two small incisions, maybe the one at the spine might be an inch or so.
And the board certified pain management physician does this?
Typically they do. Okay. Typically do, and oftentimes neurosurgeons will do this. Some of the ortho spine surgeons also do this. And sometimes you want it done by a surgeon to place an electrode and sew it next to the spinal cord. So there's a wide variety. This is a widely used technology, and there's been some big improvements with it too. They now have some sensors that detect whether you're lying down or standing up, and it automatically changes.
Who does this work best for?
Typically for people.
So somebody watching this, they're in pain, but they haven't gone to you yet because they don't want medications, they don't want injections or whatever. Who's the best candidate?
Typically people who have nerve pain, what's called neuropathic pain, which is more of a burning or stinging. Frequently it's done when people
sciatica?
It can be sciatica, and it's typically though if you failed other treatments, and oftentimes it's if you failed surgery as well.
So this is not a first-line therapy?
No, you wouldn't want to do this first line because if you had sciatica, a simple thing, maybe you inject some steroids, takes down swelling, pressure comes off the nerve. I mean, that's simple. Why would you want something implanted?
Well, forgive me, Dr. Reinhart.
That's okay. Well,
it just sounded so easy that I thought, why not do it first?
Yeah, just right when you're born.
So, but here's the thing. Over the year, I mean, you've been doing this a long time. And people need to mention, I mean, you have one of the busiest pain centers in California and maybe even the world. I mean, very busy. Well, I mean, you have 40 employees, but it's a very busy center.
Yes.
And all you do is pain all day long.
Correct.
But have you ever had patients, and this is for the person watching this, and I know it doesn't work every time, like you said.
Right.
But
you
do
get
you ever
to
have
try
patients that come in, they're in pain, and they come in, they get this done, and it's 100% reversed? Has that ever happened?
It's really changed.
In your career?
It's really changed people's lives. Absolutely, has changed their lives.
So is the answer yes? That's
yes,
happened?
that's absolutely happened. absolutely happened.
Interesting. So that's so spinal cord
Stimulation.
stimulator.
Right.
And what are the patient's fears? Because messing around with a spinal cord, is that a fear of theirs?
Well, again, it's typically these are people who've already had maybe numerous spine
A lot of things.
surgeries
Okay.
before, or other procedures done before, have problems like arachnoiditis, where there's clumping of the nerves, things that really aren't amenable to any other sort of treatment. And this can be very, very effective. Or
Are
even
there-
complex regional pain syndrome, RSD.
Well, are there people that have had surgeries that, in your opinion and estimation, that they didn't need the surgery, that this might have worked?
Well, what I
That
was
means they should have at least tried this first?
Well, and that's an option now. Sometimes the carriers think we'll go for the definitive procedure first, which may be surgery. And there's certainly cases where if you need surgery, you need surgery. But if you end up with pain after surgery, there's studies that show that if you look at going and doing a second operation versus putting in a spinal cord stimulator, the 5-year outcome is much better with a spinal cord stimulator.
Okay.
So
good.
if you've had surgery once, and you're thinking you may need surgery again, and again, there may be reasons you need surgery again, but if you don't, if just pain is the issue, then a spinal cord stimulator is certainly something to look at. And again, you get to try it first. It's always reversible. Even if you have it implanted, let's say 3 years later, they have the perfect surgery that always works.
And what kind of pain again is
take it
this
out.
best for?
This is for neuropathic pain or nerve injury type pain.
Okay.
But it can
Like
often be used
burning,
for a lot of other things.
that
Yeah,
kind of
typically
pain?
that pain is a burning, stinging electrical shock, something like that. Not your dull, achy pain.
Now, do you ever have patients, because of the internet, and I think I interviewed you about 13, 14 years ago, but because of the internet and everybody's smarter now, right?
Right.
Do they come in saying, I need a spinal cord stimulator, I want to try a spinal cord?
You do.
Do they?
Well, usually you get that. Maybe it's not so much the internet, but if they have other friends or other people they know that have that, then they may come in and be asking.
Because I
about
know that my doctor friends, that like Dr. Oz, for example, okay, I happen to really like the show. And so primary care physicians are going, they're coming in and saying, Dr. Oz said cinnamon will reverse diabetes, or right? And they didn't hear the whole story, right? But so now, because of this show, I was just thinking, people are going to be going into their pain management doctor saying, I want a spinal cord stimulator. Do you think that might happen?
Well, maybe
because
so.
Dr. Reinhart said.
Well, maybe so. And again, outside of the show, going to an appropriate physician who understands your whole problem, explaining the problem, is really the appropriate thing. So this is just information for them, one of the options that may be appropriate for patients, but you can never substitute that for a physician's evaluation.
Okay, good. I want to thank you for coming on the show.
Thank
Always
you
a pleasure,
again.
Dr. Reinhart.
Thank you.
You've been watching the Wellness Hour Live. I'm Randy Alvarez. I wish you good health.